Governor Charlie Baker has been talking about vaccine equity since day one. But 2.5 months into the state's rollout, clear divides remain. Statewide, Black and Hispanic people make up 8 and 12% of the population, but just 5 and 4% of those who've gotten at least one dose, respectively, while white people who've gotten their first shot are nearly even with their share of the population. And in Boston, Black and Hispanic people make up 25 and 20% of the population, but just 18 and 9% of first doses, with white residents getting an outsized share of vaccinations. Numbers like those have prompted a renewed push from the governor in recent weeks to work with local leaders and community health centers to close the gap, as he highlighted yesterday from the Morning Star Baptist Church, where the Mattapan Community Health Center has been running a clinic for the past couple of weeks.
With this clinic, they're working to break down barriers to the vaccine and to improve health outcomes for people here and elsewhere. We recognize there's a hesitancy around the vaccine, and much of this hesitancy is born of generations of systemic racism and disproportionate access to quality medical care in Black and brown communities. These trusted neighborhood-based institutions are a key part of how we overcome that challenge.
You can trust this church, you can trust these institutions, and you can trust this vaccination. People are doing well here, and people are continue to come. The numbers are rising more and more.
The Morning Star Baptist location is one of 7 vaccine sites being run by community health centers in Boston. And the man you just heard was Bishop John Borders, who joins me now, along with Sandra Cotterell, CEO of Codman Square Health Center, which is running another site out of Russell Auditorium in Dorchester, along with Boston Medical Center. Sandra and Reverend, it's very good to see you both. Thanks so much for joining me.
Thank you for having us.
Sandra,
great. You know so well. It's great to see both of you. 2 issues confronting particularly communities of color are access and hesitancy, and you're both addressing both. Can we start with access for a second? Reverend, how did the church become a vaccination site?
A representative in community relations from BMC, Boston Medical Center, asked if we would be concerned, if we would be willing to consider Morning Star as a vaccination site. Now, the context is very interesting because we've been closed to public worship since March of 2020. So this, in my opinion, was a crucial step forward in opening again to the community, to the public, for public worship. And then when I think about all the various funerals that we've had where we could not have congregants gather, it was heartbreaking. So we jumped at the opportunity. And also, there were many seniors from the Mattapan community interested in the vaccine.
Sandra Cotterell, how did Russell Auditorium become a vaccination site?
So we started doing testing at the Russell Auditorium. So in the early phases of COVID, when the Russell became our testing site, and we also wanted to make sure that we had a location that was accessible to the community, but that could also be a place to do a large number of vaccinations. And the health center is a busy place. And so since that had been a great location for our testing site, we converted that into our community vaccination site. And it has ample parking, and it was just a great location, and it provided better access for our community.
And Sandra, correct me if I'm wrong, the people you're vaccinating are a product of outreach. You're reaching out to the patients of the Codman Square Health Center and hopefully getting a response from them. How many are you vaccinating now, and what's the ultimate goal in terms of numbers, Sandra Cotterell?
So the site itself, it's vaccinating about 100 and 150 a day, but has the capacity to do 1,000 a day. And we hope that we ramp up to that 1,000 within the next couple of weeks, because we realize the quicker we get people more vaccinated sooner, the sooner we are heading in the right direction. And so right now we are reaching out to a lot of our patients who are still 75 plus, those that are in the 65 to 74, and those that have 2 or more comorbidities. And so we are calling each and every one of them with also outreach staff from BMC calling, and we're actually actively booking them. And so right now there's about 5,000 patients that we are outreaching to schedule them for that location.
And Reverend Borders, my understanding is people are booking appointments at the church through Boston Medical Center. Is that correct? And what are the numbers, goals at your place?
Boston Medical Center does have an online form that people can take advantage of, but they're directing people mainly to the state's website, and people are signing up all over the state. And we began with a hope to vaccinate 100 people a day. I looked at the registration today, and there were 247 people signed up for vaccination today. And we're looking at ramping up to 500 people a day, possibly.
Reverend, how does it make you feel when you see people coming into the church for what is likely, in many cases, life-saving help?
I'm very excited. We've always been concerned about the community at large. We've dealt with a lot of crises and major events in the Mattapan community and the Boston area over the years. We've dealt with a lot of funerals of murdered victims and gang members and things like that. So to be a part of the healing process is very important. We're not just concerned about the spirituality of people, but we're concerned about their bodies and their stomachs. At one side of the building today, as I left the church just an hour ago, and a gentleman walked in to receive a food basket from our food pantry. And then I said, well, thank you very much, about to close the door behind him. And he said, no, wait a minute. I'm also here for my vaccination.
That's great.
So when you put those things together, that's very powerful.
Sandra, if I can turn to you, let's talk about hesitancy for a minute. We've almost every night on the show talked about the numbers and the huge divide, particularly between people of color, particularly among Black Americans, and what they have lived through and people before them have lived through, which makes it painfully understandable. But I am guessing you're experiencing less of that because you're dealing with patients who are familiar and I assume trust you. Is that a fair assumption?
I think that's a great assumption. I think that, the health center has been serving the community for over 40 years, and they know their providers, they know the staff. And I think that goes a long way in terms of breaking down those barriers or concerns. And I think also making sure that there's access and easy access. I mean, anytime you put a barrier in front of someone, that can be make it difficult. But I think that, reaching out to people, and once they say they're ready, that goes a long way in terms of when they can get that appointment and get it quickly. And I also think that the more and more of us that take the vaccine in the community and share our stories with family and friends that we've taken it and we want them to take it, and people look at really returning back to some level of normalcy, all of that combined has gone a long way, I think, in terms of breaking down some of the concerns around hesitancy. When I walk through the health center and patients talk about wanting to see their grandchildren, wanting to get out and about again, wanting to get rid of their mask. I mean, those are all real and true stories. And I think engaging with people and bringing that sense of hope, I think, goes a long way. But I think, as the Reverend said, trusted institutions, trusted organizations, community health centers, church leaders, and our providers that they know go a long way.
So, Reverend, what do you say to an individual, let's say one-on-one, who says, I know you, I trust you, I don't trust the vaccine?
You're leading to two concerns that I have. I'll answer that question if I may begin with this. The two concerns that I have is that those of the younger generation are not interested in taking this vaccine, or at least they want to find out more and more about the J&J vaccine before they take any vaccinations. So what happens after we've vaccinated the 75-year-olds and up, the 65-year-olds and up, the 55-year-olds and up? Will we then begin to see a decrease of exposure and support because of the hesitancy of that younger generation. We're going to use social media and a lot of one-on-one contact to reach that younger generation, but that's one concern I have. And the other concern I have is that being a statewide vaccination site, Morning Star, I see a lot of people coming from around the city, but I'd like to see more people from my own community. I'd like to saturate the people of Mattapan, Dorchester, and Roxbury who would come to Morning Star for the vaccination.
Well, Reverend, all I can say is here's the saturation. I hope it happens. I want to compliment you both on your terrific work, and I hope both of your efforts become a model throughout the city and the state. Sandra Cotterell, Reverend Borders, it's really great to see you both. Thanks.
Thank you. Thank you very much.